Hello and welcome to today's episode on the state of the art in vocal folds optical coherence tomography, based on an earlier presentation. OCT for analyzing biological tissue started in 1991, and since then there has been a development where, by far, the area of eye research is in front. In the left picture below, you see the first representation of the eye background, and the right picture, the diagnostic possibilities today. As for laryngology, Brian Wong and his co-workers made a study in 2005 based on a placement of a probe just near the vocal folds and showed that the method can be used in laryngology. Since then, there has been a huge development, and we will present some of the latest studies made especially by his crew and a group in Germany. OCT is an imaging technique based on the interference of two beams of broadband radiation from a reference arm and a sample arm. The main components are a light source, an interferometer, a detector, and an application system. Time domain systems were the first to be used in eye disorders and are dependent on a moving mirror. The weak point of this technique is the need to move the reference mirror to obtain images from various depths. It creates a speed limit and can lead to motion artifacts in the scanned image. Fourier domain systems such as spectral domain and sweep source OCT both have solutions to the mirror problem. Spectral domain OCT emits the entire needed range of wavelengths all the time and uses a spectrometer to decompose the signals, whereas sweep source OCT uses a tunable laser to emit the same wavelengths in a sequence and synchronizes with the photodiode. On the left side, a schematic setup of a time domain OCT system with a corresponding OCT image and a histologic slide from the lower lip. On the right side, a schematic setup of a Fourier domain OCT system is depicted with a corresponding OCT image and a histologic slide taken from the same spot from the lower lip. The epithelial layer, the basement membrane, and the lamina propria are clearly distinguishable on the OCT images. The mucosal structure of the inner lip is very similar to that of the larynx. Fourier domain OCT is the quickest because the mirror stands still. To achieve ultra-high resolution in OCT, these following components play a significant role: high-resolution optical components, broadband light source, detection system, and scan system. Actual resolution is discerned between 2 points along or parallel to the beam path. Lateral resolution is the ability to discern between 2 points perpendicular to the beam path. As long as probe tissue contact is possible, high actual and lateral resolution can be obtained. For the developed system ultra-high resolution OCT, the penetration depth is 0.0 mm, and for the commercial system COCT, it is 1 mm. For the skin, you can purchase isotropic 1 micrometer resolution OCT systems. Isotropic means that there is the same properties in all directions. The penetration depth is about 0.4 mm in these images. Quantitative assessment of the vasculature network reveals pathological and nutritional underpinnings of the microcirculation for oral lesion recovery. The progression of oral capillary angiogenesis, indicated by elevations in capillary loop density, occurs within 12 hours of disease onset and peaks at day 7 thereafter, which provides invaluable information for the time course of the therapeutic treatment. This shows the potential movement of oral cavity OCT toward clinical translations, and of course, ultra-high resolution OCT will optimize the findings. We present various endoscopes, and highlighted in the red square is the most interesting one. It is a sweep source OCT, 1310 nanometer with 200 kHz, and VCSEL means vertical cavity surface imaging laser. As you can see, the working distance is 7 to 10 centimeters from the tip of the probe to the vocal fold. And unfortunately, the lateral resolution is 100 micrometers. The image shows an OCT coronal plane with the subepithelial lesion on a single frame. The cross-sectional OCT image of the vocal fold depicts a subepithelial hypodensity. The scale bars on the image denote 500 micrometers axially and laterally. Scaling was adjusted for the epithelium and the lamina propria. These 3 patients are presented at both 12 and 250 frames per second in the coronal plane with delineation of superficial vocal folds. These 4 images are examples of OCT, here of mucosa of the inferior nasal concha. Image A is normal, while image B is of chronic vasomotor rhinitis, and C is of allergic rhinitis, and lastly, image D is of atrophic rhinitis. These 3 OCT images shows a normal healthy mucosa of the pharynx, and B shows a hypertrophic pharyngitis, and the last image C is after the therapy. The OCT images below have been used with deep learning technology to detect possible cancer. The left image shows a hyperkeratotic lesion at the floor of the mouth, whilst the right image shows no clear border, meaning there is an invasive lesion at the floor of the mouth. Here is an example of OCT and artificial intelligence for cancer detection. The picture shows the workflow of the deep learning used for automated tissue classification in OCT images. First, an OCT image is pre-processed, and afterwards it is going to be analyzed by deep learning techniques such as convolutional neural networks. The output of such could then classify the tissue into different groups. This is the propagation of the vocal fold mucosa, where on the right side image the vertical displacement in males was 1.38 micrometers and 1.24 in females. For the x-axis horizontal wave, 30 points were distributed equidistantly along the width of the superior contour of each vocal fold. Image A shows the vocal fold before laser ablation of a hyperkeratotic lesion of the left vocal fold in an outpatient setting. Image B shows the vocal fold after laser ablation, depicting a smooth epithelial surface, especially presented in image 25. In summary, ultra-high resolution OCT can be used for many benign disorders as well as for malignant disorders, documenting diagnostics and treatments effects not only to classify but also evaluate function of the larynx, especially vocal folds. The method is ideal for prospective randomized controlled trials. Thank you for watching.